Naman is a long distance runner. He started participating in half marathon races of late. He says he occasionally develops stiffness around the low back and right thigh. As a coach, trainer, or a therapist, you try to check and compare the range of motion of both hips. You find a difference in the range of motion while doing a straight leg rising in both legs. Is the difference in range of motion due to restricted mobility or flexibility? If you're looking for answers to these questions, you're in the right place. Welcome to this NPTEL offered course on physical medicine and rehabilitation in sports. We are in week 6 discussing flexibility and mobility. So, today's lecture is on joint mobility and flexibility. What are the differences and significance in sports? You are with me, Wing Commander Chandrasekhar Guru. I am an associate professor in sports medicine from Department of Sports Medicine, Armed Forces Medical College. The learning objectives of today's lecture will be on what is flexibility and mobility, what is the difference, and what are the importance in sports. What are the various factors that influence this flexibility and mobility, and how incorporating the training methods can improve these factors. Practical aspects will be discussed with respect to the flexibility and mobility aspects of it using a case scenario. So, why do we need to discuss mobility and flexibility? Because it is integral component of athletic performance. It has both mobility and flexibility as a established role in prevention of injury, and these are terms which are often confused, but then yet they have clear distinct concepts. So the differences depends on the sport specific demands in terms of biomechanical, physiological and neuromuscular of that particular sports. So, coming to what is joint mobility? Joint mobility is the capacity of a joint to move actively through a range of motion. So, the word that you need to underline here is active. It depends on the joint structure, the soft tissues and the neuromuscular control. So, it is more of an active movement that happens, that is the joint mobility. Whereas flexibility is the ability of the muscle or muscle groups to lengthen, and this is influenced by the muscle tendon properties and the extensibility of the connective tissue, and it is more of a passive component. So, when we compare mobility and flexibility in simple terms, mobility is joint focused and it is of active control, whereas flexibility is muscle focused or connective tissue focused, and it has a lot of passive potential for flexibility. So, you can say also in other words that mobility is a bigger subset, is a bigger entity under which you have flexibility as a subset of mobility, but it is not vice versa. So, the anatomical influences which affects are bones, ligaments and joint capsule, which are part of the mobility because it's mainly involved in the joint movement, whereas muscle length, the fascia and the connective tissue, they are all anatomical structure which influences the flexibility component or the passive component. So, the nervous system is the one which controls these anatomical factors. What is the neuromuscular control? So, it is a brain body connection wherein mobility is mainly restricted to the motor control. So, it is of it, you can say it is more of an effector organization wherein the proprioception and reflexes to the senses are achieved through mobility, whereas flexibility is more of a activation of the neuromuscular component by sensing the change in the length or by the development of the force. So, it is more of an affector component. So, that is an effector component, this is an affector component, and hence it is more it plays an important role in the range of motion or the muscle length. How do you test mobility? Mobility can be assessed using functional movement screen. As we discussed earlier, functional movement screen has 7 different type of movement patterns based on which you can assess the motor control or the movement pattern of a particular individual, and you can rate them objectively from score of 1 to 3 for each. So, it becomes total score of 21. So, any score which is 2 or below helps in kind of giving some corrective exercises and try to address the movement. You can also check the joint specific range of motion of a particular joint. So that is tested using a goniometer. In the picture you can see a goniometer with a objective angle reading displayed. So that is a stationary arm and a dynamic arm. The stationary arm is fixed to the proximal segment, and then the distal arm is made to move across. So entire range of motion can be measured in an angular objective manner. So that gives the range of motion with respect to the joint mobility of that particular joint. So there are two different types: active mobility and passive mobility. Passive mobility, you know, if I kind of make the individual to make the range of motion. Active is where the active component, namely the neuromuscular coordination and the activation of the muscle is involved. So it is more of an effector component. So that gives exactly the individual's ability to do the range of motion. So that is the active mobility. What is flexibility then? Flexibility can be tested using entire degree of flexibility can be tested using something called as the sit and reach test, which is used to give a flexibility in terms of a measurement in a scale for the entire body. So that is a sit and reach test which is being demonstrated. The other aspect of checking flexibility for the lower limb, mainly the hamstring, you can say, is a straight leg raise. So you can ask the individual lie flat on the couch or on the floor, and then ask the individual to raise the leg with the knee tightened or extended. So that shows the amount of length or the flexible nature of the hamstring, which is in the posterior compartment. If the hamstring is tight or stiff, it will not allow the individual to lift freely. So that is a straight leg raise test. You can also use various tests, muscle length tests for various group of muscles. Say Thomas test, generally used to check the muscle length of the opposite leg, hip flexors. So these are various muscle length tests which can be used to check the flexibility of particular joint. So what is the significance in sports of flexibility and mobility? Both are useful in performance and injury prevention. Mobility mainly in terms of the foundational, in terms of dynamic movement, it is important in terms of improving the performance per se. Flexibility, it assists in the movement economy. When the flexibility is good, it means that muscle length is optimum. So muscle length has an important role in the force production. So thus it also has a role in the movement economy also. If the muscle is stiff, then the compensatory pattern or compensatory stress happens on the other structure. So that can again can impair the movement economy. Balance again is required for optimal performance, right? So balance is also a component of, you can say, mobility, wherein motor control is again involved, neuromuscular coordination is involved. So for example, in running, when there is excessive mobility of the ankle, so that can cause compensatory movement at the level of the knee and at the level of the hip as well, since it's the entire kinetic chain that is involved. So that can cause kind of problems in terms of maintaining the optimum movement efficiency. Hamstring flexibility again is again an important aspect in runners. So hamstring flexibility can also impair the movement efficiency. Say coming to sports like Olympic lift, you want to do Olympic lift, it requires mobility at all the major joints like shoulder, the ankle and the hip. If they are not properly mobile, the joint mobility is restricted, then there are compensatory movement that can happen in the proximal joint. So that can decrease the performance and also make the individual more prone for injury as well. In gymnast, if you see gymnast, more than the mobility, it is the flexibility which is a major role to play, where if the muscles are extensible and the connective tissues are extensible, they are able to reach that particular range of motion and the kind of performance in the gymnastics. So thus role of flexibility and mobility have distinct kind of demarcation, but both are required for optimum performance in sports. Let's see a case scenario. Naman, again we started with this particular case wherein Naman is a long distance runner. He started participating in half marathon of late, and then he occasionally developed stiffness around the lower back and right thigh. So as a coach, how would you kind of further assess this individual, see what is the problem, whether mobility or the flexibility? So it's a long distance runner. Straight leg race test is basically used to kind of check the hamstring flexibility. Generally, hamstrings are tight in long distance runners because of the increase in the load and the cyclical nature of the running per se. So these, because of the hamstring tightness, there is reduced flexibility. So what you advise is that you ask them to include proper warming up and cool down sessions, because it is also important to have a proper preparation and proper cooling down back to the pre-activity state, so that there is reduction in the injury rate. Second thing is, the cool down session should also include additional static stretching sessions of major muscle groups, namely the hamstring, the hip flexor, the quadriceps, and the calf muscles. And also you can also implement in individuals who had previous history of injuries, or they have undergone already kind of various other rehab protocols earlier. You can include certain PNF stretching techniques also as part of their weekly training program. So that kind of helps in maintaining the balance between the injured limb and the non-injured limb as well. So that is again an important factor that one can consider. So what are the influencing factors of mobility and flexibility? Let's focus first on mobility. Mobility, it is not only restricted to the joint, the factors are even beyond the joint as well. So joint per se, it's the joint structure. So any pathological problem in the joint structure can definitely cause problem in the mobility. Say for example, routine activity overuse injuries, there may be degenerations which can happen if there is an injury per se around the joint. So that also change the joint biomechanics. So that can also lead to kind of compensation and internal structural problems as well. So that can cause the mobility issues as well. There may be soft tissue, the soft tissues around the joint may be involved, may be injured, or may be inflamed. So that again may, while healing, may result in kind of adhesion. So that can affect the mobility. Most commonly in post-surgical cases, you have a problem with respect to the mobility of the joint. Motor control is again an active thing, wherein the neuromuscular control is involved. So especially post-injury, the proprioception and the coordination and balance are kind of affected. So it is important to institute these kind of drills, mobility drills, in their sports rehabilitation to attend to these particular problems. Pain, again, pain as such is a protective response. So pain causes kind of compensatory inhibition of the muscles around the region of pain. So that again can affect the mobility of that particular region. What are the factors that can affect the flexibility? Flexibility factors are mainly related to the muscle and the connective tissue factors. So it is the viscosity of the muscle. So how can you increase the viscosity of the muscle? By using some passive eating modalities. If you use a passive eating modality, that increases the muscle viscosity, so that can help in increasing the muscle length as well. So this again can be used in sports performance, wherein where you have individuals with where you need to you can introduce certain passive eating modalities to increase the muscle viscosity, and thereafter cause an active warm-up protocols as well, especially when you are practicing in cold climate, area where the temperature is very low. So there you can use these methods. Connective tissue stiffness, again, if the connective tissue is stiff, probably in some chronic or systemic inflammatory conditions, you have the connective tissues are stiff as such because of the inflammation that is ongoing in the body. So in these people, again, this can affect the flexibility of that particular joint. So that can compromise the muscle length and thereafter the range of motion as well. Neural tension again, if the muscle gets stiffer, the nerves which pass by also can get kind of stuck to the adhesions and the inflamed muscles or the connective tissue. So that also can kind of influence the flexibility. So neurodynamic techniques are there to kind of reduce this problem because of the neural tension. Temperature and fatigue, as we had discussed, temperature, if the temperature is more, the extensibility is high, so obviously the flexibility will be better, whereas if the temperature is lower, the extensibility is lower, so obviously the flexibility will be the stiffness and the flexibility will be there. So this is again, these are the factors that can influence mobility and flexibility. Focusing on how do you train for mobility in sports. So we know mobility is distinct in terms of active range of motion involving motor control and neuromuscular coordination, right? So obviously the training will include dynamic mobility drills. Like during warm-up session, you can include mobility drills in terms of hip or the knee range of motion exercises. You can use controlled articular rotations in sports rehabilitation, where you can use mobilization with movement or passive joint mobilization techniques to kind of cause joint mobility, increase joint mobility in a controlled manner. You can also increase the resistance training through full range of motion. So incorporating resistance training in addition to the achieving a full range of motion also helps in kind of power generation in the required optimum range itself. So that also helps in improving the mobility. What are the various techniques that can use to improve the flexibility? These flexibility we have discussed in the previous lecture also. So in cool down routines, you can use static stretching. In sports rehabilitation, if you need, the requirement is to increase the range of motion as compared to the other side, then you will go for PNF related techniques, which can be scheduled to 1 to 2 sessions in every week. And dynamic stretching can be used in warm-up sessions in the general warm-up protocol. If you can use ballistic stretching in specific warm-up protocols. Coming on to the age and gender considerations, we have discussed again in the previous lecture. With age, there is kind of decrease in the flexibility and the stiffness increases in the connective tissue. So it is important to consider the age aspect. In young athlete, they become more flexible, there's less of control. So the training program should have more of dynamic related stretching training, so that movement control is kind of achieved first. And in older adults, it is the opposite, wherein the static component or flexibility is reduced. So it is important to include more amount of static stretching techniques in case of older adults. Thus there is a different connotation in the training program designing with respect to the age as such. Gender, as we discussed, gender, because of the hormonal differences, female are generally more flexible. So it has to be considered in their kind of training program. Because of the increased flexibility in certain sports, female have more propensity to develop joint instability as well. So that again has to be considered. Appropriate stability related exercise and reduction in the flexibility related training have to be undertaken appropriately. So these have the training implications in their designing of the training program. What about the mobility and flexibility in rehabilitation? So it is a prioritization strategy basically. When we consider rehabilitation, the incorporation of specific training in the rehabilitation should be dependent on the phase of rehab. As we know that the phase depends on the physiological nature or the progression of the tissue healing response. So generally in phase 1, as we discussed in the week 4 of this particular course, phase 1 is mainly focused on the achieving movement control and subsequently range of motion towards a minimum required range by the end of phase 1. Phase 2 is predominantly more focused on reaching a full range of motion and subsequently into the resistance related activities, right. So, in early phase it is more focused on the mobility aspect of it. You try to kind of reach a particular range of motion and try to involve the movement control. In the later part of rehab, it is important to have more of flexibility related aspects and more control using resistant training as well, using resistant training in the entire range of motion that is required. So that's how you can plan. How do you integrate these programs in your routine sports programs? If these are integral part of injury prevention and reducing the injury risk, right. So these have to be integrated in the sports training program. So you can combine the mobility related in your warm-ups and sport specific movement preparations in terms of using specific group of exercise or order of exercise, so that they also aid in kind of performance enhancement, also help in kind of achieving a desired movement and preparing the neuromuscular facilitation as well. And the using such programs can also help in kind of individualizing the corrective exercises in a particular individual per se, because every individual is different, and using the principle of individuality, it is important to kind of tweak the program as per the need. So that can be achieved by doing a proper assessment of the flexibility and mobility, as we discussed earlier, using various tools that are available, and then appropriately incorporating certain exercises at the right time, say dynamic in terms of pre-session warm-up routines, or static for flexibility in the post-session cool-down routines. So to summarize, mobility and flexibility both are distinct, but they're complementary, and both are essential for injury prevention and performance. Assessment and individualized training are very critical. We are looking at incorporating them in sports training program. Flexibility can be improved by static holds and PNF stretches to a large extent. Mobility can be addressed by incorporating dynamic stretches and movement drills in the warm-up sessions. So lack of flexibility and mobility may also cause biomechanical alterations or compensations in the opposite limb as well as in the proximal segment. So that needs to be given attention during framing of flexibility and mobility training into your sports training programs. For those of you who are interested in learning in depth, you can refer to these references. Thank you for joining in. Jai Hind.